Alright, so will you state your name and
This is Robert Egan, surgeon, MD, graduate of Creighton University, medical school, 1958. Had surgery residency training at Creighton University Group Hospitals, consisting of Lincoln, Nebraska, St. Elizabeth's Hospital, Bryan Memorial Hospital, Lincoln VA Hospital. Finished training in 1958, completed my boards, licensed in the state of Nebraska, moved my family to St. Louis to start practice with a group of surgeons in St. Louis in July, August of 1964. I left Mary Jo and our 8 kids with a van that could not be unloaded because it was a non-union van from Nebraska. And so my uncle, Vince Houston, came over and arranged to unload the van. And I left for military training at Camp McCoy in Little Falls, Minnesota for 2 weeks. My uncle, Vince Houston, Dr. Houston, got him moved into the 4-bedroom home that we bought and situated. They got the refrigerator and everything hooked up. It was an all-electric home. And the kids were situated to start school in August, in about a month. And I joined a 4-man practice surgical group with Vince Houston, Dr. Dean Sauer, Dr. James Griggs, and myself. We had an office in Clayton, Missouri, in a prior artist home with large bay windows situated in the heart of Clayton. And we had our own private parking lot. We had lawn, squirrels, rabbits, birds. A very, very nice home with chandeliers. And we had 3 examining rooms on the first floor, waiting room, room for our employees, sign-in, sign-out room, vital sign room, and upstairs we had a super nice boardroom meeting area. At that time, Highway 40 was only 2 lanes. Now it's been made into 4 lanes and divided. Initially, I think it was not divided. At that time, there was only one hospital that was west of Lindbergh, and that was Crippled Children's Hospital. Since that time, almost all the hospitals are west of Highway 61 or Lindbergh. My first experience to medicine was when I started school at Creighton, and I went to one of the gyms, and to my amazement, the gym was filled with like 40 iron lungs, treating patients with respiratory failure from polio. Thank goodness we now have a vaccine to prevent polio, and it's made an amazing difference in the lifespans of many, many Americans and saved many lives. Even my own brother, John Egan, an engineer in California, suffered a mild form of polio, and to this day still has a partial weakness and maldevelopment of his left leg that bothers him when he tries to ski. But to help overcome it, he has become a long-distance runner, and he runs almost every day in the morning before work to maintain the stamina and strength of his leg. I was one of 9 graduates of Creighton's medical school class that chose St. Joseph's Hospital in Omaha, Nebraska to intern. It turned out there were 5 of us that wanted surgical positions. I think there were only 4 that were open for the first year of surgical training. And we used every minute of our day to gain access to the operating room and be exposed to operating room procedures and to become familiar with operating techniques, anesthesia, wound care, follow-up care after surgery, prevention of infection, and there have been just colossal changes in surgery and anesthesia, of course, over those resulting 50-plus years. One of the first patients I ever saw was a 35-year-old man, approximately, who became ill the day that he presented to the hospital and was found to have appendicitis. In spite of having emergent surgery for appendicitis, this gentleman passed away before he left the hospital. On about the 6th day after surgery, he had a ileus and a obstruction. It was kind of dismaying to me to see a patient succumb to appendicitis, but it was one of the early lessons and developments that helped shape my future into the field of surgery. In addition, I had an uncle, Dr. Vincent Houston, that was in St. Louis. There was a surgeon, and I was asked to join his practice, and we therefore moved to St. Louis, Missouri, following my completion of residency at Lincoln, Nebraska, which was the state capital, and had multiple hospitals, including a Lincoln VA hospital. I received a commendation award while I was at the VA hospital for care of veterans, and we moved to St. Louis and were initiated into the surgical field in St. Louis as central surgeons. We were not located at any hospital. We tried to be midway between multiple hospitals, and were on the staffs of multiple hospitals, including Faith Hospital, Deaconess Hospital, St. Mary's Hospital, St. John's Mercy Hospital, St. Joseph's Hospital, and other hospitals, less so, but we service surgical care for our colleagues at those multiple hospitals, and we received many referrals from doctors that we helped train in residency programs. During our practice, that left St. Louis to smaller communities, and then referred patients with surgical problems back to our care. We had a very good relationship with a doctor in DeSoto, Missouri, and his family was connected with the local ambulance service, and so whenever possible and feasible, if they had someone in our community that needed transportation to St. Louis for additional medical care, they oftentimes were directed to one of the hospitals that we attended and for us for care. What other questions do you have for me?
So Grandpa, you mentioned that your first case was of appendicitis. What, as a general surgeon, what other what range of cases and surgeries did you have on a regular day?
We had a lot of ulcer surgeries for stomach ulcers, and in our practice with my 3 colleagues, we would ordinarily in the hospital have as many as 10 to 15 patients recovering from gastric resections or a portion of the stomach, oftentimes to include the ulcer, is removed and the stomach is reconstructed. We, at one time, the four of us had between 75 and 80 patients in one hospital, and our patients overflowed the bed availability, and oftentimes we had our patients in dressing rooms and in the corridors waiting availability of a room to be admitted to. We were known as the Big Four at that time, and we had a wide area of referrals from Illinois, Arkansas, Kentucky, Indiana. At one time, I had a patient sent to me from Buzzards Roost, Arkansas. We saw a wide variety of patients, many with injuries that were acquired in agriculture, such as corn picking accidents initially, and also combines, but now with improved farm equipment and safety measures, it's very seldom that we see severe agricultural injuries as once we were frequently called on to attend to.
So can you tell me a little more about appendicitis and kind of how you would go from diagnosing and what the patient looked like to treating it and sending the person home?
Well, anyone that has abdominal pain that persists for more than 24 hours, I think of it as being a surgical problem unless proved otherwise. So if they have a pain that's persistent, if it's associated with fever, nausea, and particularly on when you examine them, they have pain at McBurney's point, which is over the appendix in the right lower quadrant, and the appropriate laboratory findings, such as elevated white blood count, you need to think that this most likely is appendicitis, particularly in a younger person. And nowadays, we use a lot of radiographic studies such as CAT scans, computerized axial tomography, to study the abdomen and look for signs of appendicitis, which radiology, and that means primarily the CAT scan, is oftentimes indicative of and diagnostic of appendicitis. However, appendicitis, I think, a lot of times can be diagnosed from the history and the physical and repetitive serial re-examinations of the patient. And if you have persistent peritoneal signs of inflammation in the right lower quadrant, persistent pain in the appropriate patient, then appendicitis is very highly likely, and it is probably indicated to go ahead with surgical removal of the appendix.